Welcome to Break the Rules with Dr. Lauren Lax, a podcast dedicated to quieting the noise in the health, food, and fitness world. Dr. Lauren is a leading nutritionist, therapist, and functional medicine practitioner on a mission to help others thrive in their own lives, mind, body, and soul. And now, your host, Dr. Lauren Lax.
Well, hello. Welcome to another edition of the Break the Rules podcast, where we talk about quieting the noise in the health, food, and fitness world. And today, super stoked to have Dr. Roseann Capanna-Hodge in the house. And today we're going to be talking all about the nuances of mental health illness / just a holistic approach to addressing not only mental health, but I would say like the viral infections that can be underlying for mental health conditions, specifically talking things like Lyme, PANS, PANDAS. Those may sound like foreign topics or concepts to some of you out there. So Dr. Roseann's going to jump in with us to really explain the connections between viral infection and mental health illness, as well as just the underlying things that do underlie mental health beyond just the brain neurotransmitter theories, so to speak. And she is a trailblazer for sure, and the founder of the Global Institute of Children's Mental Health, as well as a media expert who is changing the way we view and treat children's mental health. Her work has helped thousands reverse the most challenging conditions, including things like ADHD, anxiety, mood, Lyme, and PANS and PANDAS, as discussed, using her proven holistic therapies. She's often featured on dozens of media outlets such as Fox, CBS, NBC, Forbes, Parents, and the New York Times. So if Dr. Roseann, was so honored to have you in the house, and thanks so much for coming on. If you could,
I'm so excited to be here. And I love talking about why people have mental health issues and the surprising reasons they could be struggling, as well as all of the ways that they can have hope and take action in a different way that they've been doing so that they can reduce and reverse mental health symptoms, right? So we don't talk about that enough. And there's so many proven ways. And that's really my mission, to really bring hope to people so that they can, be focused, not moody, and feel good about themselves, because people are struggling.
Yeah. Well, I just love how you are a trailblazer in that field, because I think myself, as a byproduct of like years and years and years of therapies. Yeah.
I'm sorry, Lauren.
I know. Live to tell about it. But it really also spearheaded me into this holistic realm as well, and just seeing some of the missing links. But would love to hear a little bit about how you got into this work, because I know you've been doing it for quite some time.
Yeah. This is my 30th year in mental health, Lauren.
Yeah.
So, what happened to me is that literally this is my calling, right? So I was guided to do this work, whatever your spiritual system is, but I truly was guided from above. And so my story is, when I was 5 years old, I have an unbelievable memory, and I can remember things almost like watching a movie. And so when I tell this story, I run a movie reel. And so it was about 5, and my mom's friend, Angela, asked me what I was going to be when I was older. Of course, in Italian, she asked me, and I said a psychiatrist. And it just came out of my mouth. I had no understanding of what a psychiatrist or exposure to a psychiatrist. And then over time, I realized psychiatrists essentially are pill pushers, and I changed that to being a therapist. And that really just was what I wanted to do. I knew that I was really good at talking to people and guiding them to feel better, whatever they were struggling with. And so that's my story of how I got involved. And I've only used holistic therapies. Not that I'm not opposed, I'm integrative. So I believe in combining, Eastern and Western methodologies. I'm about using whatever works. But my work is 100% based on evidence-based approaches. So I'm a total research nerd. And when I recommend something, I really have done my due diligence and really researched, how it improves things, what's the mechanisms behind it. And really that's where I gravitated towards these things that are sort of the anchor of my work of neurofeedback, biofeedback, specific types of psychotherapy, and really how do you get the right diagnosis by using tools like functional medicine, lab work, QEEG, brain maps, and then making sure we're getting that right diagnosis because we're actually checking under the hood. Because in mental health, it's just guessing,
right?
what is going on with somebody, and then really getting that right treatment at the right time in that right order, right? So a lot of times people come to me and they've tried different therapies, but it's not the right order, right? And just to understand what that means, the whole basis of my work is boiled down to this.
Yeah.
When I work with people, I calm down that nervous system. If your nervous system is stress hyperactivated, physiologically, you're not capable of rational thought and then taking purposeful action in the way that you intend, right? So if we don't bring your nervous system down, calm it down into that parasympathetic, relaxed state, when you do talk therapy, you are wasting your time. Mm-hmm. You probably are like, amen, as somebody who struggled, right? Definitely. So my work is about calming the nervous system down and then bringing in coaching and therapy. And that's the magic juju. That's what I've been able to do with people. And there's a variety of ways you can calm your nervous system down with evidence-based approach. It's not just neurofeedback and biofeedback. And I dive big time into this in my book, It's Going to Be Okay. But that's so important for people to understand that there is really, I'm using neuroscience to help people get better. And when we look to neuroscience about, what's happening in the brain and body, right? And as you talked about, Lauren, in your intro, we have to stop thinking that genetics define us. Mm-hmm. And that neurotransmitter imbalances are the only reason why people have mental health problems. Because I'm going to tell you that that's lower on the list of why people have mental health issues. Mm-hmm. For everybody that I'm seeing and have been for a very long time. Often more commonly, it's inflammation related, chronic stress related. Are two of the biggest sources of anxiety, depression, OCD, and a host of other things, and then having medical reasons, right? Mm-hmm. So infection-induced, gut dysbiosis, just a lot of different things. It's almost rare when somebody comes in here to me, whether they're working with me in my center or virtually, and they have normal physical health, right? Mm-hmm. So such a connection, and our field in mental health is such a dinosaur. They just ignore these tools that are readily available, right? And they want to just say, well, let's look at the DSM and let's give you a medication for that, instead of really taking a scientific approach with tools that are there and have been for a long time.
Yeah. Like it feels like kind of a suppression of like the symptomology versus like a unearthing of like what triggered this beyond just circumstantial maybe makes a person sticky to that anxiety, but like, it's like what is underlying that? Because we've seen a huge uptick in mental health the past year.
Of course.
So that's a circumstance of making like anxiety. So from your experience, what makes one more prone to anxiety? And is everyone prone to it to some degree?
Listen, we have a stress response system in our body. It's our autonomic nervous system, as you're well aware of, Lauren, right? But, what is this response system? So our system is designed to handle stress, right? And then there's healthy responses to stress and there's unhealthy responses to stress. We're going to talk about that. And nobody is immune from having a stress hyperactivated nervous system. So first of all, right out of the gate, your body knows no difference between good stress and bad stress. Mm-hmm. Before we started this podcast, myself and Lauren were talking about how this was our Corona creative period. And Lauren wrote 3 books and I wrote 4 books. Mm-hmm. Pretty exciting, but guess what? We probably didn't sleep properly. I'm going to tell you I didn't.
Right.
And just really got out of whack. right? I really did a lot of countering of that high stress I use a lot of PMF and biofeedback. A super clean eater, doing all these great things, prioritizing sleep. But as I'm in the middle of this book launch, now the next book launch, my sleep's out of whack because it's too exciting. Too much excitement going on. So what I like to explain that to people is because kids are really stressed today and parents sometimes don't understand why their kids are showing anxiety and depression. And stress, good or bad, can disrupt your entire nervous system. So what are some sources? What is anybody immune? Why do some people handle stress better? So from a neuroscience perspective, the more you take care of your nervous system, okay, the better you are equipped at managing stress and coping, right? I talk a lot about something called resiliency mindset. It's actually something I trademarked, and it's how we view, manage, and recover from stress. And a lot of it has to do with temperament as well, but really, how is your nervous system regulating? So our body is designed for, you have a stressor, okay? So you're about to merge onto the highway and a truck pulls you off the road. Well, guess what? Your system is going to go into the sympathetic dominant, which is a stress response, and your blood, your heart rate's going to go up. You're going to sweat. You're going to have, looping thoughts all of a sudden, all at once. And if you have a normal system where you're taking care of it, right? You're putting oil in your vehicle, you're doing all these things. It's going to go back down, right? Not right away, because after a while you can be like, oh my gosh, I just almost got hit. Yeah. But if you have a stress activated system that's already idling towards the sympathetic dominant, and it can happen if you already are an anxious person, maybe we do have some of those genetic pieces. Maybe you have a really hard time right now in this pandemic. Maybe you've got 4 kids that you're doing hybrid at home. I'm going to anoint you and say you should be sainted. But some of my parents have that. And maybe you lost your job in this pandemic. I mean, there's like real stressors going on in the world. And according to APA Stress in America survey, 70% of parents are experiencing significant stress due to these challenges of homeschooling and working from home and whatnot. That's real, 70% of the US. That's why everybody's so darn cranky, just saying. So when you have a healthy nervous system, it goes back down. Now, there's rich get richer, the poor get poorer. So the easier you are, how you view stress has a lot to do with if your nervous system ignites quickly, right? So here's a funny story. So I am buying a new car this week. And the car salesman, such a nice gentleman, he's 70. And he says to me, I answer the phone. I'm like, hi, Joseph. And he's like, are you ever in a bad mood? You're like the nicest person. I go, he's like, what makes you mad? And I was like, oh, I know what makes me mad. It's disrespectful people make me mad. So I was like, I'm really pretty happy. And I was like, I take really good care of myself. And I have a special needs kid who's been incredibly challenging for 14 years. And he has given me the gift of prioritizing things in my life. So there are no toxic people in my life. There's no people who shouldn't be there. And I really am very high in prioritizing things. If it's not a hell yes, it's a hell no for me. And so it makes it really easy. Plus, having a really difficult kid makes it really clear who your friends are. And because people leave your life and they don't want to be there. And that's okay, because they should be there. So how we view stress is a huge part, as if that leads to anxiety and depression. That's probably really surprising to people, because they think, well, it's got to be genetics. So we have genetics. Genetics impact us, but more than genetics, it's how your parents role modeled stress. It's how people in your life role model stress. I mean, if all of us think of a really negative person that you have in your life, whether it's a friend, a grandparent, a parent, right? the moment you're around them, you're like, oh, this is tough, right? Yeah. So if you're constantly bombarded with that, it's incredibly, incredibly hard. So that's a factor, is like, who's role modeled how you manage stress, who are people that are constantly bringing stress in your life, and what are your actual situational stressors. I can have people in my life where that, I should be highly stressed, right? But I'm not. I take care of myself. I practice gratitude. So you can mitigate things by your mindset, the practices you do, prayer, having a sense of faith. I mean, there's just so many positive things, what you eat. So your lifestyle factors are going to make a big difference in how you're feeling. And obviously, if you have physical problems like infectious disease or MS, or you can go through a list of things, Lauren, right. But these are all factors in how you're managing stress. And right now in this pandemic, there are people that are experiencing anxiety and depression, OCD for the first time in their life, and they don't have a history. And that's okay. You got to get help. You got to do things to bring health into your life and prioritize your mental health.
Yeah. I mean, what do you think that is attributed to? I mean, minus a pandemic that's very stressful and a way of the world that we've never lived in. Like trauma is being brought up for people that they've never addressed. Like, what have you seen or thought theory-wise? Yeah.
Well, such a great question. So trauma, we're broadening our understanding of what trauma is. So many people, particularly people of a generation of, let's say, 50 and up, their idea of trauma is, if they were beaten, sexually abused, some kind of
losing a loved one, even.
Yeah. They don't even get that as trauma. Right. So then we're understanding that a big event occurred where somebody was physically, emotionally, or sexually harmed or neglected. Right. But now we're starting to understand things like medical trauma. Right. I can say that my son with PANS and Lyme, one of the worst experiences I had with him was actually getting his tonsils and adenoids removed. It was so traumatic, from the awful nurse to him not, we didn't know he was MTHFR. So he woke up when he wasn't supposed to wake up, and, just all of these things that occurred at that time, and being able to connect the dots looking back, right? Which we can only do, and just how horrible it was. He couldn't let go of me physically for 10 days. Okay. So, and your mom with a kid who's only, not even 3 years old, and you're experiencing this, it was awful, and you're already run down. And so that was traumatic. That was truly a traumatic event. And somebody may not connect that and then develop anxiety, they start to wear down, and they don't understand that. So if you have an unresolved trauma, you are absolutely right, Lauren. Right now, the world has a hum that it's hurting. People are hurting. I have never, ever seen people be more rude in my entire life. People are lashing out at others due to their fear and anger and distress over the world. Yeah. And so it's just a high conflict time for people.
And lack of connection.
Lack of connection. There's so many things. But there are people that are not aware that some of these things that have occurred, right? We're now even understanding the impact of having a mother who has anxiety or depression, and growing up with that is actually traumatic, right? We're learning that through research. And,
right.
Right.
Yeah.
So people's awareness of their mental health, silver lining of the pandemic, people are realizing, oh, I should be taking care of myself. More people are going to therapy than ever. It was the number one New Year's resolution was to go to therapy. It was not to lose weight.
Wow. That's cool.
Right. So people are trying, and I think therapy is great, but the work is way more than a 1 hour session with your therapist.
Yeah. On a weekly basis. Yeah. I'm so happy. Yeah. You're bringing light to that. I know. So you work a lot with children's health. And so kind of some of these things, like if mental health is, they're so young. So do you see like a lot of children's mental health being related to taking on what parents, what they're experiencing at home, and kind of like diving into some of the underlying like inflammation as well.
Yeah. So first I'll have to say things are really bad right now in this pandemic for all kids, teens, and we're learning this through survey research. And it's not just surveying the United States, it's Europe and Asia as well, because the pandemic started there first. So there's more research coming out of that, real increase in depression, anxiety, just for kids. So, but prior to the pandemic, I actually started the Global Institute of Children's Mental Health in January of 2020. I truly am on a mission to change the way we view and treat children's mental health, because it's bad out there, Lauren. And the average age of onset of an anxiety disorder is age 6. I'm getting kids at 3 years old with a diagnosed anxiety disorder already, you know, and parents are perplexed. They're scared. They don't know what the heck to do. And let's talk about this multifaceted reasons why this is occurring, because it is not one thing. And yes, how you parent a kid can have a massive effect. I dive a lot into this in my book, but we'll talk about this and what are things that we can do, because the research shows us that certain types of parenting not only create children that are socially, emotionally more well-adjusted right now at that age, but their future is better, that they are have higher incomes, better academic grades. Because listen, this is what's driving a lot of people. I don't think that should be the reason why we do things, but these kids are emotionally healthier and they just don't have the same kind of problems that kids that are parented differently. But so many reasons why kids are struggling, and parents are struggling, and they are role modeling, you know, a lack of coping skills. Our kids today do not have coping skills. It is a major, major reason why kids are struggling with their mental health. We're over-parenting our kids. We do not want them to experience a moment of uncomfortableness. And it's through the moments of uncomfortableness that they learn to tolerate and cope with stress. And without that learning, they will have no coping skills. And let me tell you, you're going to use grades. People are using grades as a benchmark of mental health. No, these are kids that struggle. They may be successful grade-wise, and we're thinking, oh, that means they're doing okay. Do you know how many people, Lauren, come to me in high school, you know, college? It's almost rare that I have kids not on psych meds in high school and college. 1 in 6 Americans are on a psychiatric medication.
Right.
So that's pre-pandemic. So we have inflammation, we have parenting, we have other stressed out kids. We have developmentally inappropriate education. We have a much higher rate of genetic mutations. There are a lot of things occurring in this perfect storm. Then now we have the pandemic, right?
Throw the pandemic on it.
Throw the pandemic. And then we also have a false belief that there's some type of magic pill that fixes everything. That's not what happens. I mean, even I use like neurofeedback, like there's pretty much nobody that I can't improve with neurofeedback, biofeedback, PMF. There's some type of therapy that regulates the central nervous system that I have. Yes, you regulate the nervous system, but if you're doing the same behaviors that are unhealthy, these habits, unhealthy habits, you're going to experience stress in a rate that's still high. You have to learn new ways to cope, to deal with uncomfortable things, or find ways to have good executive functioning skills, to get along with others. You're going to have to do some type of therapy or coaching to find a new way, right? If you're a negative thinker and I make you calmer, and you're still looking at everything in a catastrophizing manner, you're going to still be stressed out and pissed off all the time. You've got to change that. So we have to change this culture that there's some quick fix. I mean, that is a huge, huge part of what's going on, Lauren.
Yeah, the marriage of both therapies and then the underlying. Something that was just really eye-opening to me when I was working in the clinics with kids that had a lot of the mental health issues that you see, the ADHD, even anxiety, just as a spectrum, kind of autism spectrum, and then sensory processing, things like that, is just how fundamental to diet we talked about earlier. And a lot of like gut support was for these kids. And that's kind of what got me out of doing clinic work, is because I really wanted to make an impact from the inside out as well. But just seeing with the kiddos that their parents would be open to adopting like just some differences in their diet, and then doing a little bit of like some gut testing, maybe some cleanup. 80% of our brain gut connection comes from the gut. And so if there's some information going on there.
And people aren't aware of this, Lauren.
Yeah.
And when they hear that, what I want them to next hear is that you can make actions, sometimes starting out small. And a lot of these things are little changes, right? And how dramatic the effect is, it's incredible. I had Bob Hope's granddaughter on my summit, the Get Unstuck Parenting Summit, and she did an essential fatty acid for her son. And she obviously had, income, and she could go to anybody. And she was struggling to find help for this guy. And she turned to holistic methods, and she did essential fatty acids. In 3 days, she noticed a change in his behavior. And she was like, I'm doing everything wrong. And I think this is somebody that has such accessibility, but still wasn't getting what she should do. Right. Mm-hmm. Which I think is so incredible. And that's why people find you, Lauren, and me, because they are like going down the internet search rabbit hole and they somehow find us. Right.
Yeah. Well, and I guess so as a professional, and then also as a parent, when you are doing your intakes and then working with your kiddos and parents, are they already at a place where they have like changed their diet and they're already like eating healthy, or is that like something that you guys
it is, I get everything. I get people that I get, my dream is when I get people that are already holistic, and then, their platform is there, right? Talk about the 8 pillars, right? Yes. So it's a lot of the same things that you do, but on top of it, it's parenting and it's brain-based therapies, right? So some people come in like that, but most of my people are not aware of how much they can change. They're coming to me because they've been a treatment failure. They've tried medications. I rarely see people who've seen less than 10 people, and they might only be 9 years old. So they're getting me from, seeing me on TV or some way that they sort of get to me, and they don't understand the impact, right? Do I really have to do gluten and dairy free? And I'm like, well, let me talk to you about inflammation. Let me talk to you about brain inflammation. I have the power of these QEEG brain maps that actually show brain inflammation. So I could be like, see this is brain inflammation. Then they're like, my kid's brain is inflamed. I'm like, everybody's brain is inflamed with a level of toxins and stress. There's just a lot of things, right? So then I talk to them about detoxification and, and I have so many kids with PANS, PANDAS, and OCD, right? And so PANS and PANDAS and autoimmune encephalopathy are a grouping of disorders that have an infectious disease or a toxin trigger, and the body has a misdirected immune response and starts attacking itself and producing massive inflammation. And when I mean anything can show up, it could be tics, not tics like little tics, but tics, motor or vocal, OCD, anxiety, depression, a loss of skills, a regression, writing, handwriting, separation anxiety, urgency and urination. And PANS and PANDAS, it's going to be a sudden onset, and autoimmune encephalopathy is a slow start onset. And these behaviors can be scary. Kids can be overnight with rage. They can have OCD so severe that they're doing 10 hours of compulsive behaviors or having obsessive thinking. It is scary. And, infectious disease, we're living in a world of infectious disease. So I've had COVID-induced psychosis in my clinic. But it can be tick-borne, it can be strep. I mean, there just is such a list of things that it can be. And it's really on the rise, and it's not just with kids anymore. So the P in PANS and PANDAS is pediatric, meaning pediatric onset, but now we're opening up to adult onset.
Yeah.
And you can have restricted eating disorders in there too, Lauren.
Yeah.
So it's pretty incredible what is going on. And you have to do this deep work. You have to change what you're eating. We've got to get this inflammation down so that the nervous system can regulate and the body can do its healing work. Because without that nervous system regulating physiologically, your body will not allow you to heal.
Right. It's just the whole holistic from a PANDAS, just like curiosity.
Yeah.
With testing for that. There's not really a test for that, right? It's a clinical just diagnosis presentation.
Yeah. So Lyme disease, because I'd love for the two fields to merge, but that's a whole other conversation. So tick-borne illness is a major factor in PANDAS and AE. So there isn't a test. It is a clinical diagnosis for both tick-borne illness and PANS and PANDAS. Are there tests available that could be helpful? Yes. Do you have to have positive results on these tests to be diagnosed? No. Let me say that again. You do not have to have a positive test result for infectious disease or a toxin trigger or the inflammatory markers on the Cunningham panel to be diagnosed with Lyme, tick-borne illness, PANS, and PANDAS. This is really important for people to hear this because they start chasing down some kind of test when we know this, if it quacks like a duck, it's a duck. Right.
I love that.
I mean, you know what I mean? Like I had a mom and whenever I talk about stuff, please know I change details. So this is a common situation. I had a mom come to me and it was like a classic, like she should have had red, things behind her when, saying this is PANS, this is PANS, this is PANS. So she says to me, she had a series of viruses and then she developed tics. Right. So she had motor and vocal tics. Then she got sick again. And then she had sudden onset OCD. Do you think this is PANS? And I was like, of course it's PANS.
Yeah.
I mean, hello. And she's like, but the tests, the doctors keep telling me no. And I was like, you're not going to a PANS specialist. And she doesn't have the inflammatory marker on the Cunningham panel, whatever, low IG, whatever, this, that, and the other thing. It doesn't matter. You know how many years, 24 years of working with people with Lyme. Do you know how many people I have seen that they have not tested positive for tick-borne illness? Sometimes my own kid, he tested positive right away, but it was about year 8 that he had showed up with 9 co-infections. 9.
Mm-hmm.
So, and we knew he had multiple co-infections because of the behavior. Certain behaviors are associated with certain co-infections, Bartonella, Babesia. He had a lot of psychiatric symptoms. Mm-hmm. So you have to go to experts is the point of this. And so we can't get hung up. I'm a diagnostician. I'm trained to do neuropsych testing. I love diagnosis.
Right.
But we have to focus on the symptoms. And, I've seen people spend tens of thousands of dollars trying to chase down this diagnosis when they can spend the same amount of money focusing on these pillars of health. If you focus on lifestyle and all those components, like looking at your genetic mutations, checking your gut, all these components, this is what moves the dial. Right? Improving detoxification. You got a chronic health issue. You got a problem with inflammation and detoxification. End of story. Mm-hmm. That has to be addressed. Right. So, and you're going to be stressed. So you've got to do things on the behavioral mental health side to regulate your nervous system. Those are critical components, right? Of reducing and reversing mental health symptoms.
Yeah. Dr. Roseann, you're just a wealth of knowledge and just so thankful for you coming on to share that, all of this. And I think I could nerd out with you for like hours more.
I could nerd out with you all day. I love to talk about it. I'm also like a research nerd, as I said. And I think I mentioned this to you beforehand. My book has 40 pages of citations because I want people to feel good. I don't want you to hear, vitamin C doesn't make a difference in anxiety, depression. heck yeah, it does. And here's the research.
Yeah.
Lots of research, not a little research.
Right. I definitely, yes. So tell us a little bit about your book and where we can find you.
Yeah. So I have a book called It's Gonna Be Okay. And it's, proven ways to reverse your child's mental health. And because there are lots of proven ways, you're just not hearing about it. And that's a whole other story. And this book is really a step-by-step way to teach people how to do this. And yes, it's written for parents, but I'm going to tell you, this is what works for reversing mental health, period, regardless if you're a child or an adult. It's just focused because children's mental health issues are such on a steep incline, and we've got to do better. And I can't imagine what 20 years from now is going to look like. So you can get it on Amazon. And for those of you that are looking for support more quickly, I have a summit coming up in 2 weeks called the Get Unstuck Parenting Summit. And you can go to getunstucksummit.com. It's free. I truly have the most incredible speakers, and my whole work is really to give people actionable tips and tools and techniques. We are not teaching people what they need to do. And that's really what I am all about, whether you follow me on social or, you see me on TV or read my articles. And I want people to know you can do this and you can be in charge of your own health. Yes, you can have providers like Lauren and myself, and I'm happy to work with people, but 90% of things people can do on their own. And so this really is truly my gift. People have to pay thousands of dollars to work with me. And that's what It's Going to Be Okay is about. And I call it, the book is titled that because that's what I tell every parent that works with me, because we're hurting. When our kids are hurting, we're hurting. It doesn't matter what is going on with your kid, whether it's a formal clinical diagnosis or they're struggling right now during the pandemic. So, it's important for them to know it's going to be okay.
Thank you for sharing that and just that hope as well. And so I definitely will put links in the show notes and be seeing you soon too, in person. I'm going to get to meet you.
I know. We're going to have a good time.
Yeah.
Thank you so much for this conversation. I really appreciate it.